Hello everyone, it's Wednesday. Let's talk about something that has nothing to do with COVID-19. How about I remind you that twice a year we get grades from Leapfrog, the organization that uses our data to measure us against other organizations and assigns us a grade. That's a lot like report card day when I was back in school, which was a day that I didn't often look forward to. However, what I want to tell you today is that our Leapfrog grades are going to be released tomorrow. Now, they also told me that I could not tell you that once again we made all A's because that news has been embargoed until tomorrow. So I'm not going to be able to tell you that once again we all made A's, all of our adult facilities made A's, and our children's facility would have made an A if they did Leapfrog for children's hospitals. But we got all A's the last time. I can't tell you that we got all A's this time. You'll have to read about that tomorrow when it comes out. So make sure you look for Leapfrog grades tomorrow. Congratulations. Let's talk about numbers. We now have 583 people who have tested positive. That's up 10 from yesterday. We did 135 tests. We got 135 tests back. We have 44 in our inpatient care. That's up 7 from yesterday. We have 20 at Norton Hospital. We have 17 at Norton Audubon Hospital. We have 5 at Norton Women's and Children's Hospital. And we have 2 at Norton Brownsboro Hospital. We've now administered 4,936 tests. We have 164 that we're awaiting results. We've tested 1,207 employees, and 100 employees have been tested positive. We don't have any of our employees in our inpatient care right now, but obviously, we want to keep everyone who's seeking care from Norton Healthcare in our prayers as we go forward. We have 153 employees who are on furlough, and we have 1,356 who have returned from furlough. So that number continues to grow, and we're very pleased by that. Very quickly, I want to remind you, we talk about PPE every day. We think about it every day. We work hard to make sure that we have enough of it every day. But our indicators haven't changed. We continue to see the same ones in red, the same ones in yellow, and the same one in green. But let's continue to be very responsible in our use of PPE, and I assure you that we're sourcing every lead that we get about how we get more PPE as we go forward. I received some comments from many of you about the good news of the tents coming down and the hope that maybe there was a return to at least some of the normalcy that we used to have around not having tents up. And I wanted to talk a little bit today about something else that means that we're returning to normal. As you know, we're beginning to be allowed to do more elective procedures, and we will continue to open this up over the next 2 to 3 weeks. So we wanted to make sure that you understood that that means that we're going to have to do some things different as well. You may remember that we rescinded our attendance and points policy during the time when everything was going crazy and we were having to react quickly and make certain that everything was going okay for folks as they were trying to adjust to staffing patterns and things that we were doing. We feel like that we've come back to a place where all of us are going to be needed, all of us are going to be dependent on, so that attendance and point policy is going to go back into place on May 1st. Now, I want to make sure you hear this from me. It's going back in place May 1st because we do need to go back to some accountability to making sure that we're here, our patients are depending on us. But if you have a specific situation around child care or anything else that you know is going to be a regular problem for you during this time, please have that conversation with your leader. We'll do everything we can to make any accommodation necessary for you in a special circumstance. But we all need to get back into the habit of making sure that we're at work and that we're on time to work and that we're ready to serve our patients in our community. So we'll be talking more about that. You'll see some information on Insight about that, but just a reminder, we got a little time before May 1st, but we are going to be going back to our attendance and points policy. I also wanted to talk a little bit today about testing. One of the things you may remember as we started down this journey was that all of us felt that there weren't enough tests available, that supplies were in short order, we couldn't find them. There was always the issue of could we find kits, could we find swabs, and there was a lot of people that we felt needed testing, and our philosophy was always that we were going to make sure that we used our resources in a responsible way and tested caregivers first. Then we talked about we were going to test inpatients, and then we were going to test those people who are in high-risk categories. Well, the good news for all of us is that everyone's done a great job of sourcing more of those supplies around testing. We feel a lot more comfortable with the number of tests that we have. We feel a whole lot more assured that that supply chain won't be interrupted, and we'll be able to expand and move our testing in a little bit of a different direction. So I've asked Dr. Steve Hester to come today and talk with us about how we're going to approach this topic of testing for COVID-19 going forward. Steve?
Thanks, Russ. We're certainly in interesting times. So instead of giving race tips for betting this week, I'll be giving you some tips on COVID-19 testing. From the beginning of this pandemic, we've been challenged with testing availability and have prioritized testing to best protect our caregivers, inpatients, and patients at risk. Fortunately, we've seen increased availability of testing and expect this to increase over the next week. As a reminder, let's talk about the types of testing. First, PCR testing. This looks for pieces of RNA from the virus, essentially looking for the virus. This is the test that obtains a specimen by a nasopharyngeal swab and is the most commonly used test. The second type of testing is serology or antibody testing. While there's still a lot unknown about antibody testing, this test is a blood sample that looks for antibodies for COVID-19. The greatest value and primary reason at this time for the antibody test is identifying potential plasma donors. As Russ has discussed many times, we've offered antibody testing to anyone who has contacted employee health and been on a medical furlough for an illness. Just call 502-446-COVD, option 5. I'd like to explain our prioritization for PCR testing. At the center of the diagram is our healthcare team. Next includes our suspected inpatients and high-risk outpatients. This has been our testing to date, but we'll be expanding and starting tomorrow to include voluntary surveillance on all inpatients at admission. The facility educators and experienced staff that have performed the test will be providing information about how specimens will be obtained. We've been testing patients presenting in active labor now for about 2 weeks. We've tested a total of 210 asymptomatic patients, and we've found 5 positive. This continues to show the importance of hand washing, universal masking, and appropriate social distancing. As we begin to restart elective procedures, we'll also be testing all of these patients through PAT, and as of tomorrow also, the emergency departments will be able to test individuals of concern they plan to send home. Just a reminder that surveillance testing does not always require COVID isolation. So let's clarify. Tomorrow we'll be starting testing for all inpatients on admission. Pre-procedure testing will begin later in the week, and emergency departments will be able to test potential COVID-19 patients going home. The turnaround time for these results will usually be about 24 to 48 hours. So as we continue to get availability, we will likely begin offering testing for the ICCs and the offices late next week. Now, our last phase will be community screenings. Our goal with testing is to maximize our ability to identify the patients at greatest risk and make every effort to protect our caregivers. Thanks to our laboratory teams for continually working supply chains to make testing available. And I'd like to say thank you to our staff who day in and day out take care of our COVID-19 patients and do their best to bring families back together.
Thanks, Steve. It's good news for all of us that more testing is available. And like Steve, I want to make sure we thank everyone in the laboratory and everyone who has sourced the supply chain on this, because our organization's ability to test and our organization's ability to expand testing is very key to how we help this community get through this. I want to make sure you understand that last circle that you saw there of community screening is one that we look forward to doing in a way that allows us to achieve our mission, to be of service to the community and to be there for this community. As a matter of fact, tomorrow we're going to partner with the Louisville Urban League to do some testing, our first time doing community testing. We're going to be doing that testing downtown in the West End at the Louisville Urban League's headquarters. We'll be testing the clients of the Louisville Urban League as well as some residents of the West End. So we're very pleased to be able to do this. We look forward to be able to expand doing this into all parts of our community as we go forward. So again, good news for everyone, and we look forward to being able to achieve that mission that Norton Healthcare always does. I want to close today by thanking Laquita Burden and Nancy Bean for sending me a great picture that has those words that I like to say on that street sign back there. She ended her email by saying, "We sent this to you just to make you smile, so Laquita and Nancy, be assured, it makes me smile every time I see these words." The words I say to you every day: stay safe, keep the faith. We'll talk tomorrow.